Hello, I'm Dr. Lipi Roy, and welcome to my show, Health, Humor, and Harmony. On today's show, I'm going to give a status update on the COVID-19 pandemic, both in the United States and globally. I'll also be answering your questions on the current state of COVID-19. Let's get started. So what's the status of COVID-19 in the US? Looking back 2 years ago, it's hard to believe that we were all talking about this novel coronavirus every hour of every day. This SARS-CoV-2 virus was wreaking havoc on every aspect of our lives. At peak, 908,000 new daily cases were reported in January 2022, likely from the highly contagious Omicron variant. And 4,300 deaths per day were reported in January 2021. Many regions were in complete lockdown. Workplaces, schools, conferences, sports arenas, concerts. Meanwhile, hospitals were completely overwhelmed with patients infected with this new virus, requiring mechanical ventilation and high-level intensive care. The people most vulnerable to severe illness and death were the elderly, those with chronic diseases, and people of color, including Native or Indigenous people. Today, approaching the halfway mark of 2022, the outlook from a public health standpoint is far less bleak. The 7-day average for new cases is approximately 112,000, bringing the total case count in the US to about 87 million. Reports show a 7-day average of about 27,000 hospitalizations, down from a peak of 151,000 in January of 2022, and a 7-day average of about 382 deaths, down from 4,300 in January 2021. Although the US did reach a painful milestone last month by surpassing 1 million deaths due to COVID-19, globally, 551 million cases and 6.3 million deaths have been reported. So why are clinical outcomes, total cases, hospitalizations, and deaths so much better today than 2 years ago? It's in large part because of vaccinations. Scientists around the world work tirelessly to create multiple vaccines to target SARS-CoV-2. Other mitigation measures such as masking and physical distancing were also effective in reducing transmission of this respiratory virus. As of this week, the CDC reported that 67% of the US population is fully vaccinated against COVID-19. But there's huge variation by states. Rhode Island, for instance, has 84% of its population fully vaccinated, while in Alabama, it's only 51%. As a physician and public health advocate, I cannot overstate the profound impact of immunizations, which are perhaps the greatest public health discovery in human history, saving millions of lives from deadly illnesses such as smallpox, polio, measles, influenza, and now COVID-19. CDC data showed that unvaccinated people were 29 times more likely to be hospitalized and 97 times more likely to die from COVID-19 compared to fully vaccinated people. Now, let's answer some of your questions. Is the original strain still spreading? Since December 2020, several coronavirus variants have been identified and are under investigation. The Delta variant was first identified in late 2020 in India. By November 2021, a year later, Delta had spread to 179 countries. By that point, the Omicron variant emerged and was responsible for the largest surge since 2019. Today, the highly transmissible and contagious BA.2.121 Omicron subvariant is the dominant SARS-CoV-2 strain spreading among the population. Omicron BA.2 is the next dominant Omicron subvariant present in the United States. As I just mentioned, the original strains, Alpha and Beta, are virtually zero as they've been overtaken by Omicron. What about long COVID? What exactly is it? Mild to moderate COVID-19 lasts about 2 weeks for most people, but a recent study from UCLA found that about 30% of COVID-19 patients develop long-term effects that can wreak havoc for months. According to Johns Hopkins Medicine, lingering symptoms include fever, cough, fatigue, and shortness of breath. Others may experience cognitive issues like impaired memory and thinking, i.e., brain fog. So, who gets long COVID? This is an area of active research. Risk factors include people who had severe COVID illness, who have underlying health conditions, or are unvaccinated. Health inequities could also put some racial and ethnic minoritized groups at greater risk for long COVID. Scientists are researching this important health and social issue. Another question, is the vaccine safe for young children? Yes. The CDC has found that the COVID-19 vaccine is indeed safe for kids. Vaccinating your children can give parents greater confidence in having them participate in daycare, school, sports, and other activities. Vaccinating kids also protects vulnerable adults and other family members from getting COVID-19. Is it safe to go back to work? The CDC and OSHA have created several workplace-related guidance documents to help employers and staff determine if it's safe to return to work. Recommendations include screening for symptoms and exposures, vaccination program, masking, ventilation, physical distancing, and disinfection measures. Ultimately, infection is lowest when everyone is vaccinated and follows public health protocols. Are at-home COVID tests available for me and my family? Yes! At-home rapid tests for COVID-19 can give quick results and are now widely available in pharmacies and retail stores. You can also get 4 free at-home tests per household by visiting covidtests.gov. So how can you get involved? Keep up to date with trusted sources for COVID-19 information, including the CDC, Johns Hopkins Coronavirus Resource Center, and the World Health Organization. When researching COVID-19, utilize trusted publishers like the New England Journal of Medicine or British Medical Journal. You can also donate to COVID-19 patients and healthcare workers during their trying times through organizations like Nursing World, the Global Giving Coronavirus Relief Fund, and many more. Well, that's all for today. Here's your joke of the day, medical theme. The nurse said, "Doctor, a patient on the phone says he's invisible." The doctor replied, "Tell him I can't see him right now." Have a great weekend, and I'll see you on Monday, 3 p.m. Eastern. Be sure to subscribe to my YouTube channel, write comments below, and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.